Today, this episode is all about the gut. It's about the gut. Simple three-letter word. It's been a hot topic for a lot of 2020, 2019. It's a relatively new area of research. Am I right, Godfrey?
There's a lot of research going on, and of course, but there are very new things coming up.
Yeah, so I feel like we're going to have a very interesting and impactful and timely conversation here because I think that, especially 2020, just as the years go on, it seems like there's more digestive gut health issues out there, and people are suffering with mild to severe symptoms of diseases or just allergic reactions or sensitivities that no doctor seems to really be able to pinpoint, and they just don't know where to go anymore. And I'm one of these people where even though I'm studying integrative medicine and such, though I am not specialized in gut health or anything, but I have been impacted personally with gut health issues and inflammation. So let's start by, I think a good place to start would be the microbiome. So could you tell us, Godfrey, a little bit about what the microbiome is?
Yes, we as human beings have within our gut number of bacteria that are very important for our health. So we think that bacteria normally are pathogenic, which means that they create illness, but we actually do have a lot of bacteria in our gut which we need. So this is a symbiotic condition in which we need these bacteria, and these bacteria are actually in an environment that we provide. And we should keep providing that environment because they also provide us with nutrients and healthy, what we call metabolites, which means that healthy compounds that originate from our diet. Now, if I had to define it, so I like to provide two terms, which is microbiota, which are actually the type of bacteria that live in our gut, and also the microbiome. Now, the microbiome is a collection of these microbes and their functions related to which genes they have. What do I mean by that? Because we can measure and calculate the quantity and types of bacteria in the gut, and we can list them and give their quantities. But the most important is to look at which bacteria and which functions, therefore, we have available in our gut to provide us with these nutrients.
Yeah, because, like when we're asking the question of what is a healthy gut, that's also a rather like hard thing to define, right? Like really, we have so many different like ethnicities and people coming from all over the place eating different types of foods. And perhaps that has a big impact on it too, just how like your genetics, right? As you say, what types of microbiota you have. Am I right? Hopefully I'm using these terms correctly. And how you're able to digest food well, because I believe digestion is one of those markers for having a healthy microbiome. And it's just fascinating how you mentioned just the sheer numbers as well. We were talking offline as well about the number of bacteria in the gut relative to the number of human cells in the body.
So if you look at the human body, we are made up of 30 trillion human cells, representing around 20,000 genes. Whilst if we look only at the gut microbiota, we're talking about more than 100 trillion bacteria. So in quantity, in numbers, they are tenfold more than our own cells. And in genes, it's even more. It's 100 times more. So You can imagine the metabolic difference there might be between, as you said, different populations that eat differently, therefore they have different microbiota in their gut.
Yeah, it's crazy just what a difference in number that is.
I
And so
can't
then when
even
we are,
conceive of those numbers.
yeah, and like when we are talking about what a healthy gut is, it's more so the diversity, isn't it? The diversity, regardless of what kind of strains compose that diversity, it's more so having enough variety of these bacteria, right?
So the diversity is extremely important. So we normally measure diversity and abundance, yeah? But the diversity, so a healthy gut is a gut which have a good diversity of microbiota, right? Which can change, and there is specific balances that are need to be kept, and that is highly affected by the diet that we eat, which of course provide us with an opportunity, if we have any misbalance of these microbiota, to readjust before disease occurs, because this balance, which we call dysbiosis, is also related to multiple diseases. The three key functions of microbiota, the first one is to maintain the gut lining, because you know the gut lining, where the food is coming, then you of course have your tissues. That's the first barrier. You don't want food to move through that barrier, so you need to actually maintain that gut lining. The second one is actually production of metabolites that we actually need. So using compounds that we don't digest, but the bacteria will ferment for us and give us these metabolites that are extremely important, including vitamins. Yeah. And the third one is education of our immune system.
Basically, you're saying that the microbiome plays a big role in immunity. That's what you're saying.
Absolutely.
Yeah,
absolutely.
Right. So what are some of the ways, could you sum that up for us, Godfrey, please? How does the healthy microbiome contributes to the health of humans? How does it prevent disease exactly? Like, what are some of the ways that it expresses itself?
So first of all, it's defense. Yeah. So a barrier. It provides a barrier because the metabolites that these bacteria produce from carbohydrates, for instance, if they ferment carbohydrates, they produce what are called short-chain fatty acids.
Right.
Now, these short-chain fatty acids, as an example, there are three. So one of them is butyrate, which is extremely important, is the energy source of bacteria themselves, but also provides 70% of the energy source of the epithelial cells, which are the lining of the gut. Okay, so that's very important. So they provide energy, yeah, to the lining, and that it is a barrier. If this barrier is somewhat disrupted, then the cells which are normally tied together, they will start opening up, and therefore things can come through.
The leaky gut syndrome you're leading up to?
Gut. That's right. That's right. That's the leaky gut. So that's the first thing that is extremely important, which is the barrier to the environment. Yeah.
Because we've got all these different layers to get through, you know.
I'm sure not many people, you know, in the general public, general population knows this stuff, right? So this is why we are talking about it today. This is why it's so crucial, because it really enhances our immunity, or, you know, degrades it if you are not taking care of that.
Yes, so that's the second one. So immunity, you know, so it's the only way where we have the immune cells. By the way, more than 70% of our immune cells are in our gut. Okay.
Wow.
So they are there and educating themselves. So that is a very good position, because there is the environment very close to the immune cells.
A big thank you for spending time discussing this topic with us. And where can we best find you, Godfrey? If anybody is looking to learn more about the projects you're involved in, or just yourself and your studies, where can we find you?
Okay, so first of all, within the links, I will provide information in terms of articles. Within the articles, one can also subscribe to more information. So that's one thing there where I can be found, also to your listeners. And I am also creating an educational YouTube channel, which is actually
it is great. Yes,
so we discuss all these issues, and of course I will. That's very easy to find. It's my name, so you just type Godfrey Grech and YouTube and
GRECH.
So
yep, we'll have it down.
we'll somehow write it in the description of this. Right, in the description of this video. So yeah, so there are different ways how to reach me. If you Google me, you'll find me. You'll find my projects, ongoing projects. I'm in general very transparent, and I want to reach out to other people, because my mission now is not to study science and publish. My current mission is to reach out individuals and try to prevent disease.
So
and that's so beautiful.
So
a lot of
admirable,
people are doing this.
You're such a humble person. This is why we like you so much. And this is our aim. This is Vitalsphere's aim as well, to help individuals to come to a deeper understanding of their own being through yoga, meditation, healthy diet,
fitness, lifestyle, anything, not just tree hugging, but also embracing the chemical world. Because we gotta understand the context of the world in which we live, and we gotta face the realities, but we can approach that through the most holistic way possible. So
So with that, we thank you again, and see you back very soon.
I will be happy to be here.
Thank you so much.
Thank you, Godfrey. Till next time.
Bye.
Bye. Bye.